Hi everyone. So thank you, first of all, thank you so much for all the positive feedback. And so I figured, why not start on my other videos since it seems that you guys are really into this. And where else to start but with the nursing process. The nursing process, this term that's been thrown around for generations and generations of nursing students. And I remember as a student feeling like I was getting hit in the head with this term, nursing process, and what does that actually mean? I'll be honest with you, I don't think I really understood what it meant until I became a nurse, but more so when I became a nurse educator, when I started to teach you, and I started to really learn about how I should teach you and how I should write my exams and how the NCLEX writes his exams. However, my entire career, I have been using the nursing process every single day in everything that I do. Okay. And so in terms of real practice, right? I always like to say in the sim lab, in terms of real world, in the real world, a nurse may not say, oh, I have to go use the nursing process, right? We don't say that. However, we do use the nursing process in everything that we do. So just to give you an example, for example, I have my patient called Shapiro, who is due for his blood pressure medication. He is on low pressure. And pop quiz, what's low pressure for? What's the classification? And what are my two nursing considerations? Okay, well, if you said that low pressure is a beta blocker, another word for low pressure is metoprolol, then you are correct, okay? And my nursing consideration would be to check a blood pressure and a heart rate before administering low pressure, because it affects both the blood pressure and the heart rate. Now, does it make it go up or does it make it go down? Okay, hopefully you said it makes it go down. So for example, if I have Carl Shapiro, who's 54 years old, he has a history of high blood pressure and a history of atrial fibrillation. And so the doctors have him on low pressure, 25 milligrams PO BID. Okay. So low pressure twice a day. So now for those of you who are just starting, don't worry about the words and don't worry about low pressure if you don't know what low pressure is. Don't worry about atrial fibrillation if you don't know what that is. Just follow me through as I explain to you how I'm going to use the nursing process, okay? So for example, for Mr. Shapiro, he's due for his 10 o'clock dose of low pressure. And so because I know that low pressure decreases the blood pressure and the heart rate, before administering this medication, I'm going to check the blood pressure and the heart rate. And let's say the blood pressure is about 92/65 and the heart rate is about 55. Now my patient is awake and alert and oriented. He's sitting up in the side of the bed. He's eating his breakfast. He has no complaints of weakness or lethargy. So he's completely asymptomatic, even though his heart rate is less than 60 and his blood pressure is on the lower side. So what would I do next? I would, well, first of all, that would have been part of my next step, right? I need to assess my patient. If their blood pressure is low, I want to know, are they symptomatic? Does he feel weak and things like that? And so first I would assess, right? And then I want to start to go, formulate a plan for this patient. Well, my plan would include that even though the medication is ordered, I do not want this patient, the potential problem is that this patient can become hypotensive or even made more bradycardic, okay? And so I know that now I need to maybe formulate a plan for this patient. In his case, he's completely stable. So then my next step would be to notify my provider and say, call Shapiro, 54-year-old male. He's due for his 10 a.m. low pressure, 25 milligrams. But when I assessed him, his blood pressure is 92/65 and his heart rate is 55. He is not complaining of any weakness or lethargy. He said he feels fine. He just had breakfast and he's sitting up in the chair, no complaints, okay? And so then my doctor might say, hold the low pressure and recheck the vitals in 1 hour. Or why don't we lower the low pressure to 12.5 milligrams daily, but let's wait and reassess him in an hour and see if his blood pressure has come up, okay? Or maybe the doctor's going to say, let's hold the morning dose and let's just give the night dose. Regardless, I've given the doctor all of the information, or the nurse practitioner all of the information that they needed to make the decision, okay? And so now Even though I did not administer the medication, I'm going to go into my medication administration record and document that I didn't give it and why I didn't give it. Now I know that I have to still go back and check Mr. Shapiro's blood pressure because he was on this medication for his blood pressure and his heart rate. So I'm going to go back in an hour and check it, and I'm going to evaluate him. Okay, now why don't we use a different scenario? Let's say I went into the room and Mr. Shapiro's blood pressure was 145/95, his heart rate was 92, and so I went ahead and I administered the medication as ordered, low pressure 25 milligrams PO, 10 a.m. And I document it. Now I know that I just administered medication, so my plan is going to basically be that I need to reassess this patient's blood pressure in an hour and make sure that the medication did actually work, but also that it didn't work too much, that now he's bradycardic or hypotensive, okay? One more example I'll give. When you guys come into the simulation lab and you have Jennifer Hoffman, you use the nursing process without even realizing, because Jennifer Hoffman is 34 years old, complaining of shortness of breath. She has a history of asthma. She's had frequent visits within the last year. And so what did you guys go ahead and did? You went and started to assess her. And so what does my assessment include? We'll talk about that a little bit later. But then as you started to administer medications, come up with a plan to administer medications, you went back and evaluated, okay? And that's what it looks like in the real world. Now, in terms of a student, you do need to know the nursing process. You need to think about the nursing process every single moment of the day, okay? You need to eat, sleep, and breathe the nursing process, and here's why. Your nursing questions on your exams, your NCLEX questions, your simulation, everything is using the nursing process, because remember, the nursing process is that systematic way of how we do things. It's how we organize our care, okay? And so everything that we do needs to have a step-by-step phase. We're going to follow a step-by-step phase to do that, okay? So without further ado, I think I've said the nursing process maybe about 100 times already. Your test questions. You always want to see, well, the first thing I have to do is assess. So in my test question, did my nurse assess the patient? Okay, for example, the patient just fell out of bed. What is the nurse going to do first? Assess, call the provider, put a bed alarm, administer pain medicine. Okay, well, guess what? I can't administer pain medicine if I don't know my patient has pain. I can't call my provider if I don't know what to tell my provider, right? What's wrong with the patient? Did they have a contusion? Are they bleeding? What's going on? And I will eventually put a bed alarm because I know my patient is at risk for doing this again, getting out of bed or falling. However, I need to assess first to make sure that my patient is not bleeding or has suffered some kind of a contusion or has fractured a hip or something. So I'm going to assess first. Now, if the question already had the assessment done and the nurse assessed everything that she needed to assess, now we can go on to the next phase of the nursing process, okay? Now maybe we can start performing some interventions. And what interventions? Well, the interventions that are within our scope of practice. And then once we've assessed this patient and we've performed interventions within our scope of practice, then we need to notify the provider because now there's nothing else that we can do. So for example, in my scenario with Jennifer Hoffman, she came in complaining of shortness of breath. And so what did I do? I took a set of vitals. I listened to her lungs. I checked the pulse ox. Her pulse ox was 89% on room air. And so I administered 2 liters of nasal cannula. When I went back to evaluate her, her lung sounds were still wheezing because oxygen did not resolve the wheezing. But her O2 sat went up to about 91. And so was my oxygen effective? Well, it was semi-effective. I elevated the head of the bed. The patient says she feels a little bit better. However, she's still breathing at a rate of 34 and she's still wheezing and she still says she has chest tightness. So what am I going to do next? Well, now I need to notify the provider because I need to administer a nebulizer, bronchodilator, and I can't do that without a doctor's orders. And so that's your nursing process for your test question. Kind of understand the nursing process, I want to start applying that to your actual questions, okay? So the tool that I'm going to use, the resource that I'm going to use is actually ATI's book. This is your fundamentals review book. If you look at it on page 29, you have an explanation of the nursing process, but then you have some questions on how to apply it. So I'm going to read the first one to you, okay, because I'm not sure how that will look on camera. So here's question 1. By the second post-operative day, a client has not achieved satisfactory pain relief. Based on this evaluation, which of the following actions should the nurse take according to the nursing process? And most questions are not going to say according to the nursing process. It's saying that in this question because you just read the nursing process, and so they're saying that. However, most of your questions are not going to say that. They're expecting you to think of the nursing process. And so this patient, the key words here is that this patient is on their second post-operative day. They just had surgery, okay? But they did not achieve satisfactory pain. Now, I've told you several times, if I'm going to set a goal for my patient who's post-op, depending on the surgery, it might not be realistic for me to have this patient have his pain score of 0 on 0 to 10. However, in this question, it is telling you satisfactory pain has not been achieved, meaning the pain level that they feel is okay for this patient. So a functional pain, remember that I've told you several times, you want to stop getting the notion to your patients that they need to be a 0 out of 10, because depending on what's happening with them, they may not ever achieve a 0 out of 10. I mean, that would be the goal. Obviously, we would love to have our patients free from pain, but depending on, this patient just had surgery a day ago, it's not realistic for them to have a 0 out of 10. However, I want them to be able to function. I want them to, if they need to participate in physical therapy, that they're able to deep breathe so they don't develop atelectasis or pneumonia. And so now it's saying based on this evaluation, so the nurse has already used the nursing process once. She's already in her evaluation stage, and she realized that the pain is not controlled. Which of the following actions should the nurse take? Okay, so the first choice is reassess the client to determine the reason for inadequate pain relief. B is wait to see whether the pain lessens during the next 24 hours. C is change the plan of care to provide different pain relief. Or D, teach the client about the plan of care for managing his pain. Well, let's go through one by one. Remember, we just went through the nursing process: assessment, diagnose, planning, implementation, evaluation. Okay? This question is telling me this nurse already evaluated. So what do we do next? You need to go back and reassess. In my evaluation, I noticed that this patient has not received what I deemed, or what we deemed together, right, with the patient and the nurse and the physician or the nurse practitioner, what we deemed an appropriate pain level for this patient. And so now I need to go back and reassess. So let's go back and let's look to see which one was reassessed. Well, A says reassess the client to determine the reasons for inadequate pain relief. So why is it that this patient is not having pain relief? Is it that the medication that we're giving them is not strong enough? Is it that maybe the patient is trying to do too much, is walking around, or, exhibiting, moving too much and exhausting themselves? Is it that the patient takes a lot of medication at home, and so their tolerance to medication is very high? We talked about in class, when you have patients who come in and they take a lot of pain medication at home, they take a lot of narcotics at home, it's going to take a lot more pain medicine for me to control this person's pain. Maybe that's the reason, okay? B is wait to see whether the pain lessens during the next 24 hours. Well, that doesn't seem appropriate to me, because we don't want to keep this patient in unsatisfactory pain for any longer. They've already had 2 days of this. C is change the plan of care to provide a different pain relief interventions. Now that does seem a little appropriate. However, remember, I don't know why yet. I don't know why the interventions that I've already implemented have not been effective. So I need to go back and reassess. And then the last one would be teach the client about the plan of care for managing his pain. That sounds nice too, but right now I'm not managing their pain. So the teaching, that would have happened initially in my first plan of care, and then once I figure out what's going on and what I'm going to do next, then I will teach. So why don't we go ahead and look at the answer. And it says yes, A. And what I love about this ATI is that you have the rationale here, and it explains why each one is correct and why each one is incorrect. So I'm just going to read why it's correct. Even when you have an answer correct, you should always look to see why is it that you got it correct, because sometimes we just chose the right answer and we're not really sure. So here it says the nurse should collect further data on the client to determine why he has not achieved satisfactory pain relief, because various factors might be interfering with his discomfort. The nursing process repeats in an ongoing manner across the span of client care. Okay, so there you see how we use the nursing process.